This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
No problem. Thanks for hosting. Hey, everybody. My name is Chantel. I'm one of the PGY3s at Stanford. I'm joined by a couple of my colleagues who will be on the chat just monitoring. If you have any questions, just feel free to type them in and we'll address them during the talk or afterwards. But super excited. Thank you to PM&R Scholars for letting us present and for doing this every year. So without further ado, this is a formal welcome to California slide. I think you guys, Casalina just presented, so you've been formally welcomed already. But just wanted to highlight where we are in California. So this is where we are. We're in the Bay Area, and it's an awesome place to live. It's an awesome place to work, near the ocean, lots of hikes, lots of good food, lots of weather. So the Bay Area is an awesome place to live in general. When you take a deeper dive into what the Bay Area looks like in terms of our rotation sites, we can pull, if you can see my mouse here, Palo Alto is right here, and Stanford Hospital is this circle. And just a couple miles away is the Palo Alto VA, which is one of our primary rotation sites. And then when you go a little bit more south, you get to Santa Clara Valley Medical Center, which is where the majority of our inpatient rehab experience is. So that's in San Jose. Then we have 2 rotations in Palo Alto. And then when you go up a little bit more north, there's the Redwood City clinics right off of the freeway. So the Redwood City clinics are our primary sports and spine exposure. You do them as a PGY2, a 3, and a 4. So this is our primary commute line here. But just so you know, there is a rotation in San Francisco as a PGY4. That's the St. Mary's rotation. I'll talk about that in a little bit. So that's about an hour up north. And then there are some rotations where we go to Oakland and Emeryville, which is, if you follow 880 here, it's up about an hour as well. So you probably need a car for this residency program just because our sites are a little bit spread out. But in terms of where people live relative to these sites, I would say the majority of us live in the peninsula / South Bay. So between Redwood City and San Jose is where most of us live. I was just going to do a quick profile of each of the hospitals we work at. So Stanford Hospital, it's a really nice facility. This is the new hospital. It was built in 2019. Super diverse patient population that we get here, and really, really unique cases, especially in the spinal cord injury world. We do a formal consults rotation at Stanford as a PGY4. And this is what the hospital looks like on the inside. So it's a really nice facility. There's lots of places to just lounge and hang out. So I like to hang out here and just get work done or hang out with friends or co-residents here. So lots of lounge areas in the hospital as well. In our Stanford Redwood City clinics, this is where we do our primary sports and spine training. And our attendings are incredible and let us get hands-on really early. I just came off of my Stanford outpatient PGY2 rotation. So got to do a bunch of ultrasound guided injections, a bunch of spine injections as well. And there's a lot of cutting edge procedures that go on at Stanford. So our attendings get us involved really early, and we have no issues or procedure numbers for ACG and meet accreditation. And this is our rotation site in San Jose, which is Santa Clara Valley Medical Center. I actually did my intern year here, and it's an awesome place to train. It's our primary inpatient neuro rehab site. There is a spinal cord injury unit, there's a brain injury unit, and there's a respiratory rehab unit, which I'll talk about in a little bit. The primary nuts and bolts of the respiratory rehab unit are that it primarily serves patients who might be high cervical injuries, who are on a vent and are trying to wean off of a vent. So that's really good exposure, I think, to an inpatient setting. and for robust spinal cord injury care. So Valley, as we call it, is a really great place to train. And it technically is a community hospital. So we see patients from all backgrounds, and our catchment area is really wide. So we get referrals from basically everywhere to do rehab here. So really great place to train on the inpatient side here. Here's a picture of what Valley looks like on the inside. This picture here is the pool. So the rec therapist will take the patients into the pool on the inpatient and outpatient setting. Here's a picture of just the outpatient therapy gym, which is huge. And then therapy dogs back in the pre-COVID days. And I think that they'll make a comeback soon too. So really nice place to train here. And then our other rotation site is at the Palo Alto VA. This is actually one of the few polytrauma acute rehab centers in the country. And we do both inpatient and outpatient PM&R here. So it's really good exposure to the veteran population. And we actually just opened a new rehab unit a couple months ago. And in addition to what the VA has been offering, there's actually a whole floor dedicated to blind rehabilitation as well. So that's something new, and that's something that residents can get involved in as well. So this is what we call Building 500. So this is the new rehab center at the VA. So it was just opened this past year. Really nice facility. On the right here are where the inpatient units are. So like floor 2 and 3. And then our outpatient PM&R clinic, where you get exposure to outpatient MSK and EMGs, are on this first floor here. And then just a bunch of offices and areas for the patients to lounge and to hang out. So nice facility here to train as well. I just wanted to go through some sample schedules for what each of the PGY years look like. So for the PGY 2 year, each of our rotations is 7 to 8 weeks long, and we have 7 blocks per year. So as a PGY 2, there are 3 blocks that are outpatient and four blocks that are inpatient. So this is a sample schedule where, let's say a resident starts on the Stanford Sports and Spine rotation. So you're getting EMG exposure on that. You're getting a bunch of procedures and just general outpatient MSK knowledge. And then Valley Medical Center Clinic is at Santa Clara Valley Medical Center. This is pretty much bread and butter outpatient PM&R, where you're seeing discharges from the ARU setting, spasticity clinic, spina bifida clinic, pediatrics, amputee care, pretty much everything you can think about in the PM&R world, you'll see in the outpatient setting on this rotation. And then VA polytrauma, I kind of talked about that rotation already, but you see vets who have multiple injuries, usually from their time in service or from accidents. So good inpatient training to dealing with medical comorbidities that our rehab patients often experience. And then we have at Valley a formal TBI rotation and an SCI rotation. The SCI rotation ends up being a lot of the more acute spinal cord injuries who are doing their first stint of rehab. And then we have a second go around at SCI at the VA, where you typically see more chronic SCI patients. So you learn what longitudinal care looks like for a spinal cord injury patient year in and year out. And then the final rotation here is VA clinic, which is that general MSK clinic with EMG exposure. So you get a lot of inpatient and outpatient experience starting your PGY 2 year. And then as a PGY 3, you basically do your second go around at a lot of these different rotations, but you add on a formal pediatrics block here, and then you add on a formal Valley Medical Center consults block where you're seeing brain injury, spinal cord injury, amputee, prosthetic care, some workers' comp, things like that. So really good exposure on the consult setting as a PGY 3. And then you do a formal sports medicine rotation at Stanford, and that has a bunch of EMGs too. So you get your EMG numbers up pretty early on as a PGY 2 and as a PGY 3. And then as a PGY 4, if you haven't gotten all of your EMGs done yet, there's a formal EMG block at Valley. So you definitely reach all of your numbers at this point. And then the PGY 4 year has a lot of consult rotations. So you can see a formal Stanford consults rotation, a formal VA consults rotation. And then St. Mary's is that rotation up in San Francisco, where you get exposure to private practice. And I think that's really good to get exposure to multiple different settings, especially when you're contemplating what your future career looks like, because we get exposure to the academic setting, we get exposure to a VA setting, private practice here, and community hospital. So all of that is built into our residency program. And then you do a formal Stanford spine rotation where if you haven't met all your numbers on the spine rotation as a PGY2, you definitely hit them here. So what does our call schedule look like? We take home call, which I think is awesome. I like being at home and I like sleeping in my own bed. And as you get older, basically, or more senior, you take less call. So on average, the PGY2s and 3s have about 1 to 2 weekends of call per month and 1 to 2 weekdays per week. And there are technically 2 separate call pools that we have. So at Valley, you're one call pool, and I would say that you have probably 50 to 55 patients on the inpatient unit that you're covering at that time. And then the second call pool is the VA call pool added with the Stanford outpatient calls. The Stanford outpatient calls, I think I maybe have gotten called once or twice this year, but they're primarily for questions in the post-procedural setting, like someone had an epidural steroid injection and is itchy at the site and they want some advice, something like that. So the call burden isn't high for those Stanford calls. The VA call, I think the average census that we would cover is about maybe 30 to 40-ish patients, and that's including the spinal cord injury unit and the polytrauma unit in that call pool. And for all of our rotation sites, we use Epic as our primary EMR, with the exception of the VA, which uses CPRS. These are our big bosses. So Dr. Smook is our department chair. He's very well known in the spine field and very well published. He's the director of the Wearable Health Lab, super involved with clinical research, basic science research, and definitely gets residents involved in the research world early. So if you have an interest in that, definitely somebody to look into and to reach out to. Dr. Levin is our program director. He is also incredible, one of the best teachers I've worked with. He's our fellowship director as well. So he has a bunch of research opportunities, incredible wealth of knowledge, conveys that wealth of knowledge really well, and really empowers the residents to be the best that they can be. So we have really great leadership here. Just to highlight some of our different attendings, I think we have so many different niche interests, and it's really nice to just get exposed to them early. So these are just a sampling of some of our sports attendings. So Dr. Rose, currently one of the Niners team doctors. He's served multiple roles in different professional sports teams as well. Dr. Stanek has a specific interest in performing arts medicine, which is really cool and something I didn't experience before residency. So if you have an interest in that, he's developed a whole robust program here for that. Dr. Kraus is awesome. She has a pediatric specific focus, and she's very prolific in the research world too. She has her own lab and she has residents work in the lab as well. So if you're interested in sports medicine, a bunch of different research opportunities and different types of exposure at this program. And Dr. Fredrickson is very well known in the field. He's our sports fellowship director, super well published as well, and gets us involved in sports coverage early. So again, if this is something that you're interested in, we have a lot of opportunities for sports and spine as well. In terms of VA attendings, we have incredible leadership here. We have a spinal cord injury fellowship that is at the Palo Alto VA. So Dr. Oda is our fellowship director for that. Dr. Tararoka is the PM&R chair, chief at the VA, and he was a prior program director for us and is now just primarily situated at the VA. He has an acupuncture clinic, so if you want exposure to acupuncture, all of us do it as a PGY2, so it's nice to just get exposure to that. And Dr. Capizzi here is incredible. She is now the new director of the polytrauma unit and the transitional rehab unit as well. And then some of our Valley attendings. So Dr. Crew is our department chair. He's an SCI expert, really really knowledgeable and really well known in the field. So if you're interested in spinal cord injury, he's a really great resource to have. Dr. Hoy here is a graduate of our program, and he's the chief of brain injury rehab, also incredible to work with. Dr. Varma is a brain injury attending who serves as the resident liaison to the program at Valley. So listens to all of our feedback and our input, and she's awesome to work with. And Dr. McKenna is technically not a PM&R physician. He's neurocritical care trained, but he runs what's called the respiratory rehab unit at Valley, which is that unit that primarily deals with patients who are weaning off of vents. So it's really nice to get exposure to that. We help co-manage the patients in terms of a rehab standpoint, but you also learn how to handle vents and manage patients on vents. I think that's really good to add to training in general. In terms of research, I think we're really blessed to have a bunch of different opportunities for research. I think as a PGY2, I found that I probably had to say no to more things than say yes to, just because there's attendees who have so many different projects in everything that you could probably think of. And if you're still interested in something, somebody would be more than happy to mentor you in a certain project. Here's just a small sampling of some of the projects we have going on, but if you're interested in research, this is awesome to get involved in. If you're not, you definitely don't have to pursue all of these different things. And I just wanted to highlight some unique things that we have in our program. There's the biodesign innovation course, and we had a couple of residents in previous years participate in it, and actually one of our current PGY4s just finished this course. But basically, you're collaborating with different Stanford graduate school students, like Stanford School of Business, law school, med school, some residents, just to innovate and develop things that might help patient care. There have been a lot of medical innovations that have come about because of this biodesign innovation course. And I think being in the Bay Area, I think it's awesome to have this opportunity. I mean, you can build it into your elective time if this is something that you're interested in.
All right, you have 5 minutes.
Awesome, thank you. And speaking of some of that elective time, technically we have a minimum of 4 weeks of elective time in our program, but just depending on how you score on the SAE, which is that annual exam that you take in January of each year, that all PM&R residents take, you can get an additional 2 weeks. But I find that to be plenty of time to explore your different interests. And we have a bunch of different opportunities like regenerative medicine. You can focus on just spine injections or sports injections. You can do a radiology elective. You can really make what you want of that time. And it ends up feeling like a good amount of time because each of our rotations is 7 or 8 weeks long. So you get really good exposure to each of the core components of PM&R pretty thoroughly. So this elective time is a really nice bonus to that. This is us. I just wanted to highlight a couple of pictures of the residents. We love to hang out with each other, and we do it a lot. This was at our PGY2 welcome party last year. We go to Stanford football games. This is Dr. Smook and some of our residents. There are a couple of them where just the residents and faculty will co-mingle. We just a couple weeks ago had a bowling event with the faculty, and I think the attending good. So it's nice to hang out with them outside of work and hang out with our co-residents as well. This is our new PGY2 class. We just met them last week. They're awesome. Just to highlight their first day of work there. And this is Derek, one of our chiefs, at a Halloween party, and it's just an iconic picture that we always have to include. And this is to highlight our residency program really loves food. And we have a formal dumpling and noodles club in our residency at the moment. So this picture here was us traveling, I think like an hour after work to get soup dumplings. So this is a bunch of us here. Our resident retreat this past year was ramen making. So we went to SF and did like a story of ramen making class where we made the ramen and then we ate it. This is a Friendsgiving event that was hosted last year. And then this was the prior resident retreat, which was kayaking and was super fun. And then we have a super active program in general. This is Ian. She just graduated last year, but this was like, I think they won first place in beach volleyball, and Derek and Yue, who are our current chiefs, won pickleball recently too. So lots of championship DNA in our program in the intramural world. And then this is our formal winter formal. It's thrown by the ortho department each year to just get dressed up and hang out with everybody. And then lastly, just a couple of more extracurricular highlights here. So we're a pretty big ultrasound residency program. So there are some opportunities for outreach for medical students to learn a little bit more about the nuts and bolts of ultrasound. So you can help with that. This is the Arbor Free Musculoskeletal Clinic, which is technically run by the Stanford undergrads and med students. But we actually staff the MSK arm of this. So the medical students will just present to us as if we're the attending. And it's really nice to just kind of formulate a plan of care and really provide this service, especially for the underserved population in the Bay Area. So that's a really nice exposure to have. And then, like I mentioned before, a bunch of sports coverage here if you're interested in it.
Right, and you have 1 minute.
Perfect. And then this is just a sampling of things that residents do after residency. I think the summary of this is we pretty much go everywhere location-wise and in terms of career path. So if you want to just peruse through this, this is a couple of the recent things. And most recently, the class that just graduated, we missed them already, but Paige is at Spalding for a sports fellowship. Sienna's in SoCal as an attending. Jyotsna is a spine fellow at KU. Sheena is a headache fellow at Stanford. Nathan is a brain injury fellow at Emory. And Stacy and Kenny are both attendings now. So you could get a mixture of fellowship bound people and people going into general rehab, which is awesome. And within the fellowships, people just have different interests that our program nurtures. So good exposure to all of this. And here's just a list of the salary and benefits. This changes every year, so this will get updated in a couple months. We get paid pretty well, especially because the Bay Area is a little bit more expensive to live in. And we have a bunch of bonuses that get added onto this base salary that you see. So you end up making more than what you see here.
Thank you so much, Dr. Wynn.
Yeah, no problem.
We really appreciate your time. There are some questions in the chat. I don't know if I see you have some of your co-residents popping in there to answer, but maybe if everyone wants to exchange contact information or some way to follow up. But we really appreciate you coming out to share with us this evening.
Yeah, thanks so much for having us.
Yes.